Welcome to The Explainer. Today, we are diving into a really cool medical innovation. Seriously, this could completely change how surgeons treat one of the trickiest injuries you can imagine, a shattered hip.
So let me just start with a question for you. How would you even begin to fix a shattered hip socket? It's a puzzle that has stumped orthopedic surgeons for years and years, and it takes an unbelievable amount of skill to even attempt. To really get why this is so difficult, you got to understand the anatomy. The hip socket has a fancy name, the acetabulum. But here's the best way to picture it. Think of a delicate teacup, and that teacup is perfectly holding the ball of your thigh bone. Now imagine a high-impact crash. That teacup doesn't just crack, it shatters, just like porcelain. So the challenge isn't just fixing a bone, it's piecing together a fragile jigsaw puzzle.
Yeah, this is pretty much a surgeon's worst nightmare. The acetabulum is buried deep inside the body. It's surrounded by this whole web of major blood vessels, nerves, you name it. Just getting to the break is a huge challenge, let alone fixing it without causing even more damage. It's one of the toughest procedures in all of trauma surgery.
But what if there was a better way? A simpler, more effective way to do this? Well, a brand new study looked into exactly that, and the whole solution revolves around one single revolutionary piece of metal. The difference between the old way and the new way is, well, it's night and day. Traditionally, fixing these kinds of fractures meant surgeons had to combine different approaches. We're talking multiple incisions, a whole bunch of different plates and screws. It was a huge construction project. This new technique, though, one incision, that's it, and one specially designed plate that's made to fit the bone perfectly. The whole process becomes so much more streamlined. Surgeons go in from the front, it's called an anterior approach. Then they have to carefully move aside all those vital things we talked about, the nerves and blood vessels. After that, they meticulously put all the broken bone fragments back where they belong. And then, that single, pre-shaped plate gets put in place, holding the whole thing together. The key is, they can do all of this through that one single opening.
Now, an idea like this sounds great on paper, but you need the evidence to back it up, right? So, how did the researchers actually figure out if this new technique really worked? How did they measure success?
Well, they set up a prospective study. They followed 31 patients who had these exact kinds of severe fractures. By tracking them from the beginning and over a period of time, they could see what was really happening in the real world. And who were these patients? Well, the average age was around 42 years old. And look at this. The main cause of the injury, for almost 3/4 of them, was a car crash. So we're not talking about simple falls here. We're talking about major, high-energy trauma happening to people right in the prime of their lives.
To make sure they got the full story, the research team measured success from every possible angle. They took x-rays to see how well the bones were put back together, they tracked patient pain levels, and they used two gold standard scoring systems, the Harris Hip Score and the Merle score, to objectively measure how well the patients could actually move and function after surgery.
All right, so they collected all this data. The big question is, what do they find? Let's get to the results, because this is where the story gets really, really good. You have to see this. This is just incredible. In every single one of the 31 patients, the surgeons achieved what's called an excellent anatomical reduction. In plain English, they pieced that shattered teacup back together perfectly, 100% of the time. You have to get that part right for a good recovery, and they nailed it.
And, no surprise, the patient outcomes show just how important that perfect repair was. Using that Merle score, which looks at pain, walking, and mobility, you can see that the overwhelming majority of patients had fantastic results. Over 61% were rated excellent, and another 26% were rated as good.
Let's just put that in simple terms. When you add those two top groups together, you find out that nearly 9 out of 10 patients, 87.1% to be exact, had a good to excellent recovery. They weren't just fixed on an x-ray, they were actually getting their lives back. Now, you always have to be realistic. This is major surgery, so it's important to talk about complications. And yeah, they did happen in 6 of the 31 patients, things like infections or blood clots. But, and this is a big but, that rate is pretty standard for this level of complex surgery. And crucially, the researchers report that every single complication was managed successfully. So what does this all add up to? What does this mean for the future? Could this single plate and this single approach really become the new gold standard for fixing these awful injuries? Well, the study's authors seem to think so. I mean, this quote from their final paper says it all. They believe this plate can push the boundaries of what's even possible in the operating room. They say it might be a new gold standard, and that's a huge statement to make in medicine. So let's just quickly recap the big takeaways here. First, one single, specially designed plate can actually work for these incredibly complex fractures. Second, using it leads to really high rates of good and excellent recoveries for patients. Third, it could make the surgery itself simpler and safer. Now, of course, they need more long-term data to be sure, but the signs are incredibly promising.
And that kind of leaves us with one final big question. You know, medical innovation often happens in tiny little steps, but every once in a while, one idea, one piece of technology comes along that could change the entire game. So you have to wonder, could this be one of those times? Thanks for joining us for this explainer.